Functions of the skeletal system include support for the body and for soft organs in the body, protection. The brain, spinal cord, and vital organs are oftentimes encased in bone. The pelvic cavity encases important viscera. The thoracic cage encases the heart, lungs, and part of the liver. Another function of a skeletal system is movement. Bones are the levers to which muscles attach via tendons to create movement. Two other functions of bones are mineral storage. Bones are the places where minerals like calcium, phosphorus, magnesium, zinc, and other minerals are stored. These minerals are stored in the matrix of bone. Fats are stored in the yellow marrow found in adult bones. Hematopoietic tissue is found in the marrow cavities of some adult bones, like the sternum, the epiphyseal end of the femur and humerus, the pelvic bones, and the body of vertebra. Hematopoietic tissue is responsible for bone cell formation. So bone cell formation is another function of bone tissue. The skeletal system consists of bones and cartilage. As we learn in Chapter 4, there are three types of cartilage tissue: hyaline cartilage, elastic cartilage, and fibrocartilage. Hyaline cartilage is the most abundant type of cartilage in the body. Elastic cartilage is not associated with bones. Fibrocartilage is found in three places in the body: pubic symphysis, meniscus of the knee, and between vertebrae forming the intervertebral discs. Hyaline cartilage, the most abundant cartilage associated with bones, is found at the end of long bones, making articular cartilage, at the end of ribs, creating costal cartilage, the cartilage associated with the nose is called nasal cartilage, and finally, the cartilage associated with the respiratory system, which is not part of the skeletal system, is also hyaline cartilage. So the hyaline cartilage structures associated with bone will be articular cartilage, costal cartilage, and nasal cartilage. Bone tissue is connective tissue. All connective tissue is made of two components: cells and matrix. In the case of bone tissue, the cells found in the tissue are progenitor cells, which are stem cells, also called osteoprogenitor cells. Progenitor cells replicate, and the daughter cells are called osteoblasts. Blast means young. These cells are young bone cells. Osteoblasts secrete matrix, and once trapped inside the matrix, they mature into osteocytes. Another population of bone cells present in bone tissue are called osteoclasts. Osteoclasts are not related to progenitors, osteoblasts, or osteocytes. The matrix of bone tissue have two components: protein fibers, which specifically are collagen fibers, and ground substance. Essentially proteoglycans. Bone tissue, however, has a third component, which is inorganic, and it's made of calcium phosphate crystals. Also called hydroxyapatite crystals. This component is not made by the cells of bone, but rather we get it from diet, from the foods we eat. This is the inorganic component, which represents about 60% of bone tissue. Protein, fibers, and ground substance is an organic component made and secreted by osteoblasts. The organic component of the bone matrix is also called the osteoid. Osteoblasts, which are young bone cells, are found on the surface of bone. These cells produce and release the osteoid, which is the organic component of bone matrix, made of collagen, protein, fibers, and ground substance. They also help deposit into the matrix the inorganic components, hydroxyapatite crystals. So these cells will secrete matrix and start to surround themselves with the osteoid, which will be calcified until it becomes bone tissue. When an osteoblast is completely surrounded by bone tissue, it changes into a mature bone cell called an osteocyte. The mature bone cell is called an osteocyte, and it is found embedded in the matrix of the bone tissue. These cells reside inside the spaces of matrix called lacunae, and they connect with each other via extensions of their cytoplasm that travel through small canals called canaliculi. That's the lacuna of the bone bone matrix where the osteocyte is found. There is a little canal called canaliculi. Those bone cells closest to blood vessels are able to gather oxygen and nutrients and will pass those along to the cells farther away via canaliculi. That's how osteocytes maintain each other alive. The function of the osteocyte is to maintain the bone matrix, which means that they're constantly releasing new matrix and destroying the old matrix. This is a slow process that takes years, but the bone matrix is slowly and constantly being renewed. Another population of cells found on the surface of bone tissue, together with the osteoblasts, are the osteoclasts. The osteoclasts are large cells which are multinucleated. They have a ruffle border through which they secrete enzymes that will digest bone matrix. These cells destroy bone matrix, absorb it, and secrete the calcium and phosphate into the blood. Finally, the progenitor cells, also called osteoprogenitor cells or osteochondral progenitor cells, are stem cells. Just like the basal cells in the skin, these are adult stem cells of bone. They are located in the same place where we find osteoblasts and osteoclasts. Osteoprogenitor cells constantly divide, and some of the daughter cells differentiate into osteoblasts, which eventually will be trapped by matrix and be converted to osteocytes. Health of bone tissue depends on a balance between osteoblast activity, which build bone matrix, and osteoclast activity, which destroy bone matrix. As long as the activity of these cells are in balance, bone tissue will remain healthy. It is when the activity of one of these cells increases that destruction of bone tissue may follow if the activity of osteoclasts overpowers the activity of osteoblasts. Conversely, if the activity of osteoblasts overtakes the activity of osteoclasts, bone tissue will deform and grow in places where it shouldn't. Bone tissue is found organized into two types of tissue, of organization: compact bone and spongy bone. Compact bone is dense and strong. Spongy bone has a honeycomb or spongy appearance. Plates of matrix called trabeculae are going to be found at random directions within the spongy bone. The directions actually follow stress lines. Spongy bone is made of plates of matrix called trabeculae. These trabeculae lines up along stress lines. The plates of trabecula give the bone a spongy appearance. The openings or holes within these type of bone tissue are filled with bone marrow and lined with a membrane called the endosteum. Spongy bone tissue is found in the epiphyses of long bones, and it is a layer sandwiched between two compact bone layers in flat bones and irregular bones. So all bones are going to have a layer of compact bone on its surface, and sandwiched between compact bone will be a spongy bone tissue. Compact bone is bone tissue organized into small microscopic columns called osteons or Haversian systems. Osteons are built along the lines of stress of the bone of the particular bone. So compact bone is found in the diaphysis of the bone, and the osteons in the diaphysis of the bone are running along the length of the bone. Osteons consist of concentric sheets of lamellae deposited around a central canal. Within the central canal, we can find blood vessels and nerves. So osteon consists of a central canal, concentric lamellae, also within the matrix there will be osteocytes inside lacunae and canaliculi. In between osteons, there will be the remnants of old, now destroyed osteons of Haversian systems. These are the old osteons that have been replaced by new osteons. So these remnants are called interstitial lamella. Finally, around the diameter of the bone, there will be these plates of lamellae which will run around the circumference of the bone tissue. This lamella is called circumferential lamellae. So there are three forms of lamellae found in compact bone: concentric lamellae as part of osteons, interstitial lamellae, which are the old broken down osteons, and circumferential lamellae, which are plates of lamellae around the periphery of the diaphysis of the bone. Also found in compact bone will be the periosteum, held to the bone tissue by perforating or Sharpey's fibers. Finally, there will be canals at right angles of the central canal called perforating canals that bring blood vessels deeper into the bone tissue. Long bones consist of three structures. The shaft of the bone is called the diaphysis of the bone. The expanded ends are called the epiphyses. A long bone will have two epiphyses. The proximal epiphysis will be the one closest to the trunk. The distal epiphysis will be the one furthest from the trunk. The diaphysis, or shaft of the long bone, is made of compact bone tissue which surrounds a cavity called the medullary cavity. Within the medullary cavity, there is yellow bone marrow. Yellow marrow is a fatty tissue. In children, the medullary cavity is filled with red bone marrow, which is hematopoietic tissue. The expanded ends of a long bone are called the epiphyses, proximal and distal epiphyses. The surface of the epiphysis is covered with articular cartilage, which is hyaline cartilage structures that cover the ends of long bones where the bone articulates with other bones. The tissue found underneath the epiphysis is a spongy bone tissue. The surface of the epiphysis is made of compact bone tissue. Within the epiphysis, between epiphysis and diaphysis, lies the epiphyseal line, or growth line. Growing bone will display a pad of cartilage called the epiphyseal growth plate. When the bone stops growing, the epiphyseal plate has been converted to bone tissue. We then call it the epiphyseal line. There are two membranes that are found in bone tissue. The periosteum is a membrane that covers the outside of bone tissue. The periosteum is attached to bone by fibers called perforating or Sharpey's fibers. Within the marrow cavity, there's a lining membrane called the endosteum. Cells like osteoblasts, osteoprogenitor cells, and osteoclasts are found sandwiched between the periosteum and the bone, and the endosteum and the bone tissue. Notice the yellow bone marrow inside the marrow cavity of the diaphysis of the bone. Yellow marrow is made of a fatty tissue. Bone development, or the formation of new bone, is also called ossification or osteogenesis. During development, there are two mechanisms that are going to form bone tissue: intramembranous ossification and endochondral ossification. Intramembranous ossification will start late in embryonic life, early in fetal life, and it will end at about 1 to 2 years of age. Intramembranous ossification converts embryonic mesenchymal tissue into bone tissue. The types of bones made by this mechanism are flat bones, bones of the skull, part of the mandible, and the epiphyseal ends of the clavicles. Endochondral ossification, on the other hand, is going to create bone tissue from a hyaline cartilage model of bone. Endochondral ossification ends at early adulthood. The types of bones made by endochondral ossification will be long bones and all other bones in the body that are not flat bones. Intramembranous ossification creates skull bones. As the skull bones create, there are areas of ossification that remained soft tissue at birth. These are called fontanelles. Fontanelles will close at between ages of 1 and 2 years of age. Intramembranous ossification takes soft mesenchymal embryonic tissue and converts it to bone tissue. Intramembranous ossification begins when a cluster of mesenchymal cells come together to create an ossification center. These cells begin to secrete matrix from which calcium phosphate crystals will be deposited. Mesenchymal cells will differentiate into osteoblasts, which will further create bone matrix. Osteoblasts continue to secrete the osteoid, which is calcified within a matter of days. Trapped osteoblasts mature into osteocytes. So these centers of calcification continue to create bone tissue from embryonic mesenchymal soft tissue. Young woven bone will be replaced with lamellar bone, where trabeculae will appear. Blood vessels will invade the bone tissue and it will bring with them hematopoietic tissue, which will form into red marrow. Periosteal cells, the periosteum will form when fibroblasts line themselves in the length, along the length of the bone, creating a membrane, which will become the periosteum. Endochondral ossification uses a hyaline cartilage model of the bone. This mechanism creates long bones. The hyaline cartilage model of the bone will start a primary ossification center. This takes place when calcium deposits in the shaft of the hyaline cartilage bone. The calcium prevents nutrients from reaching the chondrocytes in the hyaline cartilage. Chondrocytes begin to die and deteriorate, and calcification will begin in the center or diaphysis of the long bone. At about 3 months of development, blood vessels begin to invade this hyaline cartilage calcified bone tissue, bringing with them osteoblasts and hematopoietic tissue. Notice that at birth, the diaphysis of the bone has been ossified. The epiphysis of the bone, however, both proximal and distal, are beginning to ossify with secondary centers of ossification. This allows, as the bone continues to form, for a growth plate to remain between diaphysis and epiphysis, which would allow for the growth of the bone along the diaphysis and epiphysis interface. During childhood and adolescence, endochondral ossification continues along the growth plate or epiphyseal plate. The hyaline cartilage at the end of the bone will remain as articular cartilage at the end of both distal and proximal epiphysis. Once bone growth ends, the epiphyseal plate would have become bone tissue and it would change into an epiphyseal line or growth line. One form of bone growth that persists throughout our lifetime is appositional growth. Appositional growth is the growth that thickens and remodels bone tissue. Osteoblasts and osteoclasts on the surface of the bone are responsible for appositional growth. Appositional growth occurs in both old and young bone and on the surface of cartilage. During appositional growth, osteoblasts, which are sandwiched below the periosteum, will secrete matrix in areas of mechanical stress. Osteoblasts respond to mechanical stress by secreting more matrix. As more matrix is secreted, the surface of the bone grows and grows, creating eventually a thicker growth. Further lamella will be produced around blood vessels trapped by the growth of the osteoblasts on the surface of the matrix. In this manner, bone growth in thickness in areas where the bone is receiving use. The use of the bone creates mechanical stress. Remember that the bone matrix is made of two components, inorganic calcium component and an organic protein component, which is present in the form of collagen fibers. Lack of any of these nutrients, calcium and protein, will result in small bones that are poorly developed. Factors affecting bone growth. Vitamin D is necessary for absorption of calcium from foods in the intestines. Vitamin D can be eaten or it can be manufactured in the body. The beginning of vitamin D synthesis takes place in the skin when the skin is hit by UV light. Lack of vitamin D during childhood produces soft bones. The condition is called rickets. A lack of vitamin D during adulthood also produces soft bones. The condition is called osteomalacia. Osteomalacia further develops into osteoporosis. Another vitamin crucial for healthy bone development is vitamin C. Vitamin C is necessary for the synthesis of collagen by osteoblasts. A lack of vitamin C will create bones that are brittle. Lack of vitamin C causes a condition called scurvy. Aside from vitamins, hormones can also affect bone growth. Growth hormone secreted by the anterior pituitary stimulates the growth of cartilage and bone tissue during childhood and adolescence. Thyroid hormones are required for the proper functioning of growth hormone and for the functioning of other tissues and hormones. An excess of growth hormones during puberty will cause a condition called gigantism. A deficit of growth hormone will cause a condition called pituitary dwarfism. Sex hormones such as estrogen and testosterone, stimulate osteoblast activity. This is the cause of the rapid growth seen at puberty. Estrogen triggers a quicker response from osteoblast than testosterone. So this is the reason why females grow quicker during adolescence and finish their growth quicker than males. Estrogen has a greater effect on osteoblasts. Osteoblasts will then begin to convert the cartilage in the growth plate into bone tissue, making the growth plate disappear and be converted into the growth line or epiphyseal line. Testosterone has a lessened stimulation of osteoblasts, which means the growth plate would take longer to close, and that's why boys tend to grow for a longer period of time than females, than girls. Another influence of estrogen on female bones is that during menopause, the levels of estrogen decrease rapidly. So the hormone that throughout, ever since adolescence, had been stimulating osteoblast activity, all of a sudden disappears. And osteoblast activity diminishes. And it is taken over by osteoclast activity. And that is why osteoporosis is 4 times more common in females than in males. Calcium homeostasis refers to the levels of calcium in the blood. Calcium is needed by other body systems for their normal function. For example, the nervous system and the cardiovascular system needs calcium for their normal function. The body needs to maintain normal levels of blood calcium. Calcium is stored in bone tissue. Maintaining blood calcium homeostasis will involve the movement of calcium into the blood if blood calcium levels fall below homeostatic values. PTH, parathyroid hormone, is the hormone that causes an increase in blood calcium. When blood calcium levels fall, PTH will cause the removal of calcium from bone so as to return blood calcium levels back to normal. Conversely, if blood calcium levels increase past homeostatic levels, calcitonin is the hormone that lowers blood calcium. Calcitonin will cause the movement of blood calcium from blood into bones, thus creating homeostasis levels of blood calcium. The most common homeostatic imbalance regarding blood calcium is low blood calcium. So PTH is the main hormone of calcium homeostasis. When blood calcium falls below normal homeostatic levels, PTH is secreted. PTH stimulates osteoclast activity. Osteoclasts will break down bone matrix and cause the release of calcium from bone into blood. PTH also causes the increased reabsorption of calcium in the kidneys. So calcium from blood that would normally be lost in urine will instead be reabsorbed back into the blood, thus increasing blood calcium levels. PTH also promotes secretion of vitamin D. Vitamin D is needed for absorption of calcium from foods. More calcium will be absorbed from foods, and the calcium will be deposited into the blood. So PTH acts by stimulating osteoclast activity, stimulating reabsorption of calcium from urine back into the blood, stimulating release of vitamin D, which will increase reabsorption of calcium from foods. A compound or open fracture is a fracture in which the bone, as it breaks, the ends of the bone go through the skin and pierce the skin. A simple or closed fracture is one in which the ends of the broken bone do not pierce the skin. A green stick fracture is a fracture common in young children. In a green stick fracture, the bone is a young bone with lots of collagen fibers that bend the bone instead of breaking it. When the bone finally breaks, it breaks only on one side, creating a convex side of the curve of the bone. Because this is a common fracture of young children, because young children have soft bones. A hairline fracture is an incomplete fracture where two sections of bone do not separate. This is common in the skull bones. Comminuted fractions are common in the elderly, which oftentimes have brittle bones. In a comminuted fracture, the bone breaks completely into more than two pieces. So we have several pieces of bone tissue because bone is brittle.